Hello, welcome back to Biology with Risa. This is part 4 of the reproduction chapter. And in part 4, we're going to be looking at the hormones involved in the female reproductive cycle. The female reproductive cycle, or sexual cycle, are events that are occurring within the ovaries and the uterus that occur every single month unless pregnancy intervenes. The average cycle for a female is about 28 days, but it can vary from 20 days to 45 days. During a female's reproductive cycle, there are 2 simultaneous cyclical events occurring each month, and these are controlled by shifting patterns of hormone secretion. The one place where these cyclical events are happening is within the ovaries. The other place where these cyclical changes are occurring is within the uterus. And the changes that are happening within the uterus are parallel to the changes that are happening within the ovaries. So in other words, the ovaries are secreting hormones that are controlling changes within the uterus. Let's look at the events that are occurring within the ovaries themselves. The first stage is called the follicular phase, and this is because this is when the follicles are developing within the ovaries. So remember, the follicles are spheres of cells that contain a developing oocyte or egg. And as those follicle cells mature, they start producing a hormone called estradiol. Estradiol is a type of estrogen. Estrogens are actually a group of 3 basic hormones that females produce. Estradiol, estriol, and estrone are the 3 main types of estrogens produced in the body. So during the follicular phase, the follicles develop, they start producing this estradiol type of estrogen, and then this is followed by ovulation. And this is whenever one of the mature follicles releases a secondary oocyte from the ovaries, and that oocyte enters the uterus. Once that follicle releases a secondary oocyte, some of those follicle cells remain in the ovaries. And those remaining follicle cells will turn into a hormone secreting structure called the corpus luteum. So the last stage of the ovarian cycle is known as the luteal phase because of the formation of this corpus luteum. The corpus luteum is really important because it will start secreting a whole bunch of progesterone. And progesterone is going to have a huge effect on the uterus. So simultaneously, things are happening within the uterus as well. One thing that's happening is the menstrual phase, and this is shedding of the endometrium, where the lining of the uterus, the inner lining actually sloughs off. The menstrual phase is followed by what we call the proliferative phase, and this is whenever the uterine lining starts to build up again. The proliferative phase is happening simultaneously as the follicular phase in the ovaries, because as the follicles are producing estradiol, this estradiol is signaling the uterus to start to build up its uterine lining again. The last stage in the uterine cycle is known as the secretory phase, and this is whenever the uterus is actually increasing its vascularization and secretions along the inner lining, and this is providing like the optimal environment for implantation of the fertilized egg. The secretory phase is happening pretty much simultaneously as the luteal phase, and that's because this progesterone that the corpus luteum is pumping out is increasing the vascularization and secretions in the uterus. So as you can see, the hormones produced by the ovaries is having a significant effect on what's happening in the uterus. So now let's step back a little bit and look at the big picture here of how different structures within our bodies are secreting hormones to communicate with other structures to eventually affect the reproductive cycle in females. So remember, the hypothalamus within the brain is secreting a hormone called gonadotropin releasing hormone. This hormone is stimulating the anterior pituitary gland within the brain. The anterior pituitary gland releases follicle stimulating hormone and luteinizing hormone. Both of these hormones affect changes that are occurring in the ovaries. Whereas the ovaries contain the follicles and also that corpus luteum. Those 2 structures produce progesterone and estradiol, which therefore has an effect on receptors in the uterus and causes changes in the uterus. So as you can see, one structure is releasing hormones that has an effect on another structure or organ in the body. So this diagram is summarizing the effects of these different hormones on the ovaries and the uterus. So remember the pituitary hormone levels, so from the anterior pituitary, those hormones that are being secreted are causing changes that are seen in the ovaries. So one thing that you can see, this is showing the monthly cycle from 0 to 28 days. You can see at the beginning of the menstrual cycle, the anterior pituitary starts to secrete a lot of FSH, shown in orange here. FSH, or follicular stimulating hormone, triggers the follicles within the ovaries to start to grow. Around day 14 of the menstrual cycle, a little bit before that, you'll see a peak in the luteinizing hormone secretion from the pituitary gland. Luteinizing hormone, or LH, shown in red here, triggers ovulation. So one of the follicles releases its oocyte, or egg. This is then followed by the luteal phase. So that follicle that released the egg here, the follicle cells stay behind and form what's called a corpus luteum, and the corpus luteum will start to secrete progesterone and hormones in there. If fertilization doesn't occur, the corpus luteum just degenerates and it pretty much breaks down. So let's look at what's happening in the ovaries now. So remember, ovarian hormones, these trigger changes in the uterus. So at the beginning of your menstrual cycle, remember what's happening in the ovaries is your follicles are starting to grow. As your follicles mature, they actually start secreting a whole bunch of estradiol. This hormone, estradiol, is triggering the proliferative phase of the uterine cycle. So you can see that as estradiol is increasing, what's happening in the uterus? Well, it's starting to build up its inner lining. What happens around day 14? Again, ovulation. And when ovulation occurs, in the ovaries, we have the formation of that corpus luteum. The corpus luteum starts to secrete all this progesterone. And this progesterone is really important in initiating the secretory phase within the uterus. And so now the uterus is actually becoming even more vascularized and secreting a bunch of nutrients to provide a perfect environment for the egg if it becomes fertilized so it can implant. However, what happens at the end of the menstrual cycle if fertilization doesn't occur? Well, remember the corpus luteum degenerated, so it stops producing progesterone. This drop in progesterone right here actually triggers your inner lining of your uterus to shed. And so the drop in progesterone is what triggers menstrual flow and your period to start. Then the cycle repeats itself. Once menstruation is complete, you can see the follicles start to secrete estradiol again. The uterine lining starts to build up again, and then it enters the secretory phase. If fertilization doesn't happen, then that drop in progesterone triggers menstruation again, and it just continues over and over and over again. So let's look at this again in more detail. We're going to just keep going over the same thing over and over again until it sticks in your head. So let's look at the 3 stages of the ovarian cycle. So remember, what's happening in the ovaries is controlled by FSH and LH secretions from the pituitary gland. So what's happening in the pituitary gland? Well, it starts to secrete FSH during the beginning of your monthly cycle. FSH triggers the follicles to grow. Around day 14, you see a peak in the luteinizing hormone from the anterior pituitary, and this triggers ovulation. After ovulation, some of those follicle cells stay behind, and they form a hormone-secreting body called the corpus luteum, and this initiates the luteal phase. The corpus luteum will start to secrete progesterone. However, if fertilization doesn't happen after a couple of days after ovulation, then the corpus luteum starts to degenerate. And then the ovaries again would start developing more follicles. They'll release another egg, create the corpus luteum that will degenerate, and then it will go back to the beginning again, and it just continues this cycle every single month unless fertilization occurs. All right, let's summarize the major changes that are happening within the ovarian cycle. From days 1 through 13 in the female's monthly cycle, it's called the follicular phase. This is triggered by slow rising levels of FSH from the anterior pituitary. FSH, or follicular stimulating hormone, triggers follicular development. And remember, as those follicle cells begin to develop and mature, they begin secreting high levels of estradiol. This is followed by ovulation, which occurs around the middle of a female's monthly cycle, around day 14. A peak in LH is what stimulates ovulation to occur. Now, if you looked at the graph from before, you notice that FSH also peaks too during around day 14, but LH is going to have a larger role in triggering ovulation to happen. After day 14, this is followed by what we call the luteal phase, and this is going to occur between days 15 to day 28 of a female's monthly cycle. What causes the luteal phase, again, is that ruptured follicle becomes a hormone-secreting body that sticks around in the ovaries called the corpus luteum. Now remember that the corpus luteum secretes progesterone, and that progesterone increases the vascularization and secretions from the uterus in preparation for the possibility of implantation happening based on the release of that secondary oocyte during ovulation. However, if no fertilization occurs, which is typically more common that fertilization doesn't happen, then the corpus luteum will degenerate, and it will form like a little piece of scar tissue within the ovaries called the corpus albicans. The disappearance of the corpus luteum causes progesterone levels to drop, causing the uterine lining to be shed in the process of menstruation. And then this cycle just repeats itself. Okay, so the ovaries go through the follicular phase, ovulation happens, then the luteal phase. Then the next month, follicular phase, ovulation, then the luteal phase. Over and over again, about 400 times in your life. So what are some of the signs of ovulation occurring? Some women will actually notice that their sex drive increases during the time of ovulation. Also, cervical mucus tends to increase during around day 14 of the menstrual cycle. In addition, resting body temperature will rise, usually about 0.4 degrees to 0.6 degrees Fahrenheit. In order to measure this change, though, you would want to measure it at the same time every single day. So it's best measured first thing in the morning before you get out of bed, and then recording it for several days to see the slight changes in body temperature. One of the most obvious changes that can actually be detected by ovulation kits is that surge in LH. So the surge in luteinizing hormone occurs about 24 hours prior to ovulation, and you can actually buy ovulation testing kits to see when you're ovulating during your menstrual cycle. And another thing I just want to point out is that your ovaries usually alternate which one ovulates every month. So usually your right ovary might ovulate 1 month, and then the next month your left ovary will ovulate, and so forth. All right, so now that we've looked at the ovaries in detail, let's look again at what's happening within the uterus in more detail as well. And first, what I will do is describe what's happening in this picture again, and then in the next slide, I'll summarize the key points of each phase of the uterine cycle. So remember that what's happening in the uterus is controlled by estradiol and progesterone, which is released by the developing follicles and corpus luteum in the ovaries. So it's the ovarian hormones that are actually causing changes in the uterus up here. So at the beginning of the menstrual cycle, remember that's when the follicles are developing in the ovaries, so they're producing a whole bunch of estradiol, and that estradiol level is starting to increase. As the estradiol level increases, it initiates the proliferative phase in the uterus, causing the lining of the uterus to start to thicken. Now remember that at day 14, what's happening in the ovaries is ovulation. So a secondary oocyte is being released, And whenever that after ovulation happens, that corpus luteum structure within the ovaries starts to produce progesterone. And you can see the progesterone rising after ovulation has happened. This progesterone triggers the secretory phase in the uterus, where the uterine lining is becoming more vascularized, and it's also secreting a bunch of different nutrients in preparation for the fertilized egg to implant. However, if fertilization does not occur, the corpus luteum degenerates within the ovaries. This causes progesterone levels to drop. This drop in progesterone level is what triggers your uterus to shed its inner lining, and that leads to the menstrual phase of the uterine cycle. So let's summarize the 3 stages of the uterine cycle. It begins again with this menstrual phase, and that usually lasts from anywhere from 1 to 5 days, depending on the female. This is when the functional layer of the endometrium is sloughed off or shedded from the uterine lining, and it's caused by a drop in progesterone. That's whenever you lose this functional layer here of the inner lining. This is then followed by the proliferative phase, and this is triggered by estradiol secretions from the maturing follicles. They promote growth or regrowth of the uterine lining here. Specifically, the layer of the uterine wall that's regrowing and being shed off is this layer called the functional layer. And the last phase of the uterine cycle is known as the secretory phase. This is occurring between days 15 to 28. So remember, this is triggered by high levels of progesterone being secreted by the corpus luteum after ovulation. This increases the amount of vascularization and triggers a release of more secretions from the uterine cells. This is all in preparation for implantation to occur. All right, so in this slide, I'm going to be summarizing all the really important points that you should be taking away. I recommend studying this slide over and over again to make sure that you understand what each hormone is triggering inside a female's body. Also, I recommend studying this diagram and being able to explain this diagram to somebody. Because if you can explain what is happening in the ovaries and how that's affecting the uterus and so forth, and you can describe everything going on in this picture, well, that means that you have a good understanding of this topic. All right, so let's look at regulation within the ovarian cycle. So what's regulating the ovarian cycle? So remember, these are hormones secreted by the anterior pituitary gland. A rise in FSH, in other words, follicular stimulating hormone. That rise in FSH is triggering follicular development. So the follicles within the ovaries are starting to mature because of this FSH being secreted. That causes the follicular phase. Then you see a large peak in the luteinizing hormone. That triggers one of the mature follicles to release its secondary oocyte, and that is called ovulation. Once that mature follicle releases the secondary oocyte, the mature follicle sticks around in the ovaries and becomes a corpus luteum. That initiates the luteal phase. This corpus luteum will produce what type of hormone? Remember, it's secreting progesterone, and that progesterone will continue to be made unless fertilization doesn't happen. And if fertilization doesn't happen, the corpus luteum degenerates and becomes this scar tissue called the corpus albicans. Let's look at what's happening in the uterine cycle. So the uterine cycle, remember, is regulated by hormones released from these maturing follicles, as well as the hormones being released by the corpus luteum within the ovaries. So the maturing follicles here, remember these follicular cells shown in pink here are secreting estradiol. So as the follicles mature, estradiol levels are increasing. And this is going to have an effect on the uterus because it promotes the proliferative phase within the uterus. After ovulation occurs, the corpus luteum starts to secrete progesterone. And this high level of progesterone initiates the secretory phase of the uterine cycle. However, this is again preparing for implantation, but if fertilization doesn't occur, there's going to be a significant drop in progesterone levels because the corpus luteum degenerates. This drop in progesterone triggers the menstrual phase and shedding of the uterine lining. So now that you understand the female reproductive cycle, let's talk about menopause. Menopause is the cessation of the menstrual cycle, and this typically happens around the age of 45 to the age of 55 in females. What triggers this to occur is that there's actually very few follicles left within the ovaries at this stage of a female's life. So menopause usually begins when there's only about 1,000 follicles left. Remember, follicles make estrogen. And if you don't have any follicles left, then your body's producing less estrogen. Since you're producing less estrogen, well, your uterine lining stops to thicken. And since your uterine lining stops to thicken, well, that's going to stop menstruation because there's now nothing to be shed from the uterus anymore. So now we've talked about what happens when fertilization doesn't occur and the hormonal changes that occur simultaneously with that. But let's talk a little bit about what happens when fertilization does occur and what hormones help to sustain pregnancy. So when fertilization does occur, the following 3 hormones will influence pregnancy the most. The first hormone is known as human chorionic gonadotropin, or HCG. This hormone is extremely crucial in sustaining early pregnancy. Why is that? Well, HCG is produced by the developing embryo and placenta right after fertilization pretty much has occurred. This prevents the breakdown of the corpus luteum. So this causes the corpus luteum to stick around longer. And so the corpus luteum can continue producing progesterone, and it also will produce some estrogen as well. And it will keep producing progesterone to prevent the uterine lining from shedding. How long does the corpus luteum stick around? Well, it's going to stick around till about 12 weeks after ovulation. So it sticks around until the placenta is large enough to take over progesterone production itself. So the other 2 hormones that are really important in sustaining pregnancy are estrogens and progesterone. Remember, these are produced by the corpus luteum for the first 12 weeks, then by the placenta. Once the placenta is large enough, it will take over and the corpus luteum is no longer needed. Estrogen and progesterone sustain pregnancy by thickening the endometrium and by preventing menstruation. So as long as you keep progesterone levels high, it prevents the uterine lining from shedding. This is one of my favorite graphs because it does a great job of summarizing the hormonal changes associated with pregnancy. And it's showing the changes in reference to weeks after ovulation. So about 38 weeks after ovulation is whenever birth would occur. So let's look at the beginning here. So we will begin with ovulation. You can see that progesterone and estrogen levels are present within the female at this time because the corpus luteum is there. The corpus luteum is producing progesterone and estrogen. If fertilization didn't happen around this time right here, the progesterone and estrogen levels would drop and the uterine lining would shed. However, because in this case fertilization occurred about a week and a half after ovulation, the fertilized egg will implant in the uterine lining. After it implants, the embryo will start to produce HCG, human chorionic gonadotropin. This hormone, like the levels just increase exponentially after implantation. And so you can see HCG levels get extremely high. Why does this occur? Because this is triggering the corpus luteum to stick around and continue producing estrogen and progesterone. Around week 12 to week 13 or so, the placenta is now large enough to produce estrogen and progesterone on its own. So the corpus luteum degenerates and the placenta now is producing significant amounts of progesterone and estrogen, and it's kind of taking over sustaining pregnancy. And because around week 13, the HCG is no longer needed because the placenta has taken over the corpus luteum can degenerate, around week 13, HCG levels will drop. One other really interesting thing about this is that pregnancy is divided into 3 trimesters. The first trimester lasts about 13 weeks, and it's associated with the mother usually feeling the most amount of sickness. So she'll feel nauseated. Even though they call it morning sickness, it usually lasts all day. So one question that a lot of people have is, what is triggering this morning sickness or this feeling of nausea during that first trimester? And one thing that we think is associated with the feelings of nausea is actually the HCG levels. Because notice, HCG levels are the greatest until week 13, and then they start to go down. So it's probably this increase in HCG that's triggering the nausea that most women feel whenever they're going through that first trimester. This HCG is also extremely important because it's detectable in the urine about 8 to 9 days after conception, so after fertilization. And this is what home pregnancy tests actually detect. So if there's a high enough HCG level, then you're going to get a positive pregnancy test. Remember, HCG is extremely important in stimulating the growth of the corpus luteum. It prevents the corpus luteum from degenerating. Furthermore, HCG levels only drop once the placenta starts taking over the production of progesterone and estrogen. Estrogens and progesterone, again, are secreted by the corpus luteum for about the first 12 weeks until the placenta takes over. And then once the placenta takes over, then progesterone and estrogen levels will stay elevated throughout the entire pregnancy until birth. And then right after birth, progesterone and estrogen levels drop, as well as any remaining HCG levels will drop completely. And this just also demonstrates why mothers tend to feel a significant amount of hormonal changes right after giving birth, because you can just see the drastic change in the hormones within her body after birth. The last thing I want to talk about is the role of 2 other hormones during pregnancy. Relaxin is a hormone that's secreted by the placenta, and it's going to be secreted near the time of labor. And as its name implies, the relaxin actually relaxes the ligaments in the pelvis, so it helps to loosen all those ligaments so that it makes birth easier. It also relaxes some of the blood vessels, and it causes the cervix to soften and dilate. I'm actually 38 weeks pregnant right now, and I'm starting to feel the relaxing of the ligaments in my pelvis, and it almost feels like my hip is extremely loose, and it's actually kind of painful to walk just because I don't have the amount of support in my hips as I used to have. Another thing that relaxing does is it starts to cause the cervix to soften and dilate. So there are a couple different stages that occur right before labor and then during labor. And before labor, some of the things that occur at first is that the cervix starts to thin out, and we call that effacement. So here you can see the cervix is very thick, but now you can start to see how it starts to thin out as you approach labor. Another thing that relaxing is helping to do is it's helping to dilate the cervix. So initially the cervix is completely closed, but then it has to start to dilate to make enough room for the baby to fit through. And so here it's dilated a little bit, and then once the cervix is fully dilated, it's going to be at 10 centimeters. And just to give you an idea of how big 10 centimeters is, this cashew jar here, the lid here, is 10 centimeters. So the cervix has to dilate this much for the baby's head to fit through and for delivery to be successful. So the other hormone that's really important in pregnancy is called human chorionic somatomamotropin, or you can just remember it as HCS. It's also known as the human placental lactogen, or HPL. This is also secreted by a placenta, but what you really just want to know about HCS is that it modifies the mother's metabolism during pregnancy in order to help support fetal nutrition. And this is going to become extremely important, especially in a mother that is malnourished. One thing that it does is it decreases the mother's insulin sensitivity. So this actually lowers the mother's ability to utilize glucose herself, and it actually keeps the glucose in the blood to make it available for the fetus. It also, HCS also increases the breakdown of fat to release free fatty acids into the blood to provide more nutrition for the developing fetus as well. This is the end of part 4 on reproduction, and the next video will be part 5, and it will introduce you to some of the causes of infertility, as well as introduce you to some of the different types of contraceptives that people can use and how they work.